The topic for my media presentation is clozapine-induced constipation and paralytic ileus. This topic is important to me because of the time spent at my placement, Pilot Place Society, which is a 24-hour full-support residence that provides round-the-clock care for individuals who are schizophrenic and schizoaffective. Most of the residents at my placement take clozapine for the antipsychotic treatment, are powerful drugs that stabilizes their positive symptoms of schizophrenia, such as loud outbursts and behavior that is viewed as socially inappropriate. Clozapine allows the residents to maintain a level of functioning in their lives and help them to have purpose within their community and home. In addition to maintaining their symptoms, clozapine, when administered without monitoring and additional treatments, can be responsible for an individual developing constipation and, in worst cases, paralytic ileus. This past year, one of the residents at my placement passed away due to severe medical complications directly related to clozapine treatment, severe constipation, and not being able to properly treat the individual. Paralytic ileus is an obstruction of the intestine due to a paralysis of the intestinal muscles, and paralytic ileus can be fatal when not caught in time. It is too late for the necessary interventions and management strategies. Clozapine is a second-generation antipsychotic medication that reduces the positive symptoms of schizophrenia by correcting the imbalance in brain cells. There are a number of serious negative side effects from taking clozapine, such as weight gain, diabetes, increased cholesterol, tardive dyskinesia, and severe constipation, which can develop into paralytic ileus. Antipsychotic medication, such as clozapine, is known to be a strong anticholinergic. Anticholinergics are pharmaceutical drugs that impact parasympathetic nerve impulses, which basically mean that they block signals sent from the brain to different muscles in the body. The blocking of these signals results in inhibiting the gastrointestinal tract muscles from working effectively and reducing muscle secretions. Digested food can remain in the gastrointestinal tract, causing constipation and even necrosis of the gastrointestinal tract. Ensuring that individuals do not develop constipation and paralytic ileus as a result of antipsychotic medication is a complex task because of a few factors. People who are schizophrenic are often limited in their ability to express their discomfort. This makes it difficult to surmise that a resident may be experiencing constipation or worse. Another factor that makes it hard to prevent constipation from occurring in the body is the need to live an active lifestyle, being mobile and exercising. The schizophrenia disorder often reduces an individual's drive to be active and mobile when compounded with the side effects of weight gain, high blood pressure, and sleeplessness. This becomes an arduous task to get schizophrenic individuals moving and being active. Maintaining a healthy diet that consists of high-fiber foods is another important factor in prevention that is hindered because of the symptoms of the disorder. The use of stool softeners and laxative are administered as a daily preventative measure against constipation. Attentive monitoring protocols are also necessary. Part of the monitoring protocols are getting blood work done and toxicity levels checked. I have chosen the PICO format for developing my research question because this resonates with me because it relies on evidence-based medicine that gives a beginning and an end to a question. My research question, after using the PICO format, was: are there current or alternative or new treatments accessible or in development that can help to reduce or manage the severe constipation and paralytic ileus that schizophrenic individuals develop as a result of antipsychotic medication? Clozapine is an extremely effective treatment for schizophrenia, which is why it remains to be the most prescribed antipsychotic drug for schizophrenic or schizoaffective individuals. The benefits outweigh the side effects, which is why it is important to have the best possible maintenance and monitoring protocols to prevent and reduce the impact of the severe side effects, like constipation and paralytic ileus. A vast amount of resources go into monitoring and maintaining individuals who are on clozapine treatment, up to 7% of overall cost, given even more reason to prevent them from being admitted to hospital for serious medical emergencies. Considering how important clozapine is as an effective treatment for schizophrenic individuals, it is necessary to continue the search for effective methods and approaches to reduce the harm that clozapine side effects have on the body.